Good morning. Hello, this is Dr. Atar Rahman Khan, consultant in internal medicine. Today I am going to talk about a very important issue that is called heart attack. Heart attack is taking place every few seconds in the United States. One person gets a heart attack, and 50% of heart attack patient victims will die on the way to hospital. It is said that time is muscle. As soon as you feel that you have a tightness of chest, especially on the left side of your chest, and if you have a pain, severe pain like an elephant sitting on your shoulder, on your chest, that's nausea, vomiting, lightheadedness, shortness of breath, crushing chest pain, you feel that you are going to have a heart attack, call 911 in the United States of America. In Bangladesh, call 999, and in other countries they are called call code, or get somebody to bring you to the emergency room, because time is muscle. Door to balloon is 20 minutes, it is said, means that when you came to the door of the emergency room, then you are being transferred to the cardiac cath lab, and the balloon will reach to your heart. That should take 20 minutes, not more than that, so that you can salvage the affected muscle. Coronary artery disease can cause coronary artery disease blockage, or coronary artery spasm can cause heart attack. A heart attack is a very serious matter. It can kill in a few minutes. As you remember, Tim Russell, anchor of Sunday NBC Sunday program, he died and collapsed in the NBC building in Washington, D.C. years ago. He was so pleasant guy, so nice guy. I used to watch his program on NBC on Saturday, every Saturday in the United States while I was in the USA. He collapsed in the building and CPR was started, and he was taken to the George Washington University Hospital in Washington, D.C. However, the poor guy died, and resuscitation was started, but it failed. So he had a severe anteroseptal MI, which caused him, which we call widowmaker, meaning that when he died, he made a widow. His wife became widow. So this term is used in Bangladesh even, and I try to say all the time that a widowmaker heart attack is a very serious matter, and it is serious heart attack, and it can cause anteroseptal MI and the severe crushing chest pain with a history of diabetes, hypertension, with a history of dyslipidemia, high cholesterol, with a history of metabolic syndrome, with a history of smoking, with a family history. And these are the components that can cause heart attack. As I said, in different kind of things, age is a factor that you cannot change your age. At the age of 45 and above, the male is more risk, and at the age of 55 and above, female is more risk. You cannot change this age. You cannot change your genes, a family history of heart attack. You cannot change if your father or brother or sister had a heart attack. Can you change it? No, you cannot change it. Yes, now you can change. Like you have a history of tobacco abuse or drug abuse or alcohol abuse. You can quit that. You can quit in cold turkey. It's not a big deal. There are a lot of people I met in the United States of America, in the Middle East and in Bangladesh. When I say that stop smoking, and they trash the smoking packet of expensive cigarette into the trash in front of me, and I saluted that guy, and that guy has a normal life. His blood pressure is controlled, his cholesterol is controlled, he did not have a heart attack and will not have a heart attack. That's what I believe. High blood pressure and diabetes. I told in many videos that 5 to 10% of weight, your target is to lose 1 to 2 pounds a week, not too much a week. Then you can control your hypertension, and you can control your diabetes and high cholesterol without having any medication. If you are obese, you cannot remain obese for a long time. So you have to make a plan. to do some exercise. At least 30 minutes of brisk walking is essential for your life, or 150 minutes of brisk walking a week, or any kind of exercise is very important to you. If you have family history, you cannot change that. If lack of physical activity is making you obese and can cause metabolic syndrome. Stressful life is not good for you. You try to manage your stress, and if you have a history of, if you are a woman, if you have a history of preeclampsia, you have a risk of heart attack. The heart attack patient can immediately be transferred to the emergency room and to the hospital where cardiac catheterization is available. An interventional cardiologist is available, and he can do a emergency PCI, percutaneous intervention, where a cardiac catheterization can take place smoothly by an expert cardiologist, and he will send a catheter with a balloon to your heart, then see and send some dye to take an imaging of the cardiac coronary vessels if a vessel is blocked. Not only that, coronary artery blockage can cause heart attack. Coronary artery spasm, especially those who are cocaine abuser, those who are amphetamine or yaba abuser, those who chain smoker, they can have a coronary spasm without having any much cholesterol into their blood vessels. So therefore, if your cholesterol is normal, don't think that you are free from heart attack, or you can prevent a heart attack if you are a smoker. Therefore, I request you have to give up your bad habit and stick to diet and exercise, as I said. Plenty of fruits and vegetables 4 to 5 times a day, and 30 minutes of brisk walking or bicycling or any kind of exercise, even freehand exercise or resistance exercise, that's all you can do. And you try to do a good thing for you and your family or for the society, because you are supposed to do a good thing. So because you are created by Almighty God to do something good for others, not only for yourself, your family and others. If you can do a good things every day, your brain will think good, your mind will think good, your heart will stay good, your immune system will work good for you. If you betray to the society, if you betray to the people, and you have an evil mind, then that is not good for your heart, that is not good for your immune system, that is not good for your future. I hope I can save some life today. If someone is listening to me anywhere in the world, there are 800 billion people in the world, and there are millions of heart attacks every year. 10 to 15% of the people will suffer from a heart attack yearly, and there are thousands of people, tens of thousands of people has heart attack, and every few seconds there is a heart attack in the United States of America. May God bless you. I hope that there is no heart attack in you and in your family. Be careful.